Good afternoon, everyone, and thank you for joining us for this webinar, which we will be exploring careers in counseling and mental health professions. My name is Holly Sarif, and I'm the chair of the Department of Counseling and Mental Health Professions, and I hope to spend some time today discussing some of the opportunities here at Hofstra and careers in the mental health areas. Let me begin by discussing a little bit about the areas that we offer here at Hofstra. In counseling and mental health professions, the department, we have four main areas: our counseling program, creative arts therapy, marriage and family therapy, and rehabilitation counseling. And I'm going to spend some time discussing each of these different areas to give you an idea or to begin to think about which area might best fit your interests. I'll begin with the counseling programs, and in the counseling programs we actually have multiple possibilities as well. There's the mental health counseling program, the school counseling program, and the college student development counseling program. I'll begin with mental health. The program here is a Master of Arts in Mental Health Counseling. Many people will say, well, what is a mental health counselor? And as you can see here from this slide, a mental health counselor works with individuals, with families, with groups, all ages, from literally young children till older adults. And we address mental health concerns, depression, anxiety, substance abuse, eating disorders, loss. There's a whole gamut of things that you can see that are discussed and worked with a mental health counselor. People often ask, where would I work if I became a mental health counselor? And of course, a major area is hospitals, but also outpatient care centers, nursing and residential facilities, individual and family services. There's some work in the government. And of course, probably one of the major things is private practice. So you may be aware that in 2006, New York State actually added licensure for mental health counselors, creative arts therapists, and marriage and family therapists, and rehab counselors. Mental health counselors. And at that point, that meant three things. One, that people with these licensures are able to open up their own private practice, and they are able to receive third-party billing from insurance companies. And so those were real big changes in 2006. Licensure had been in other states, but New York did come on board in 2006. So how do you become a mental health counselor? It is a 60-credit program, and when you graduate, you are licensure eligible. This includes not only the academic work, but also an internship, a supervised internship, which for this program is 600 hours. When you graduate, again, you'd be licensure eligible, which means you'd be qualified for the New York State limited permit, which would allow you to work, and at that point you would be earning your postmaster's clinical hours towards your full licensure. And for the mental health program, that is 3,000 hours post-graduation. So you would graduate from Hofstra licensure eligible, receive your limited permit from New York State, and then start working under supervision. All that would have to be done, obviously, if you think, well, I would like to open up my own practice, that's great, but you would have to be fully licensed, and to do that, you'd have to have a minimum of those 3,000 hours. We often get questions regarding the difference between mental health counseling and social work. And this is something that you can find actually on our website and also on the website of the New York Mental Health Counseling Association, which really discusses clinical training for mental health counselors versus licensed master social workers and licensed clinical social workers. So there are some differences in philosophy, and there are some differences in clinical training that you can clearly see here. Most recently, I will tell you that we spoke to one of our supervisors, our internship supervisors, and they really discussed some of the differences in the internship experience, which included that many times they find that the social work interns are doing significant amount of discharge case management and discharge planning, whereas the mental health counselors oftentimes are doing more of the direct counseling in those settings. So again, they're both very valuable professional occupations. It is an area that you have to decide, and that's one of the things I hope that you get from today's webinar, is what type of area are you actually interested in working with, and what type of populations are you thinking about working with. Substance abuse counselor is a big area at this point as well, and there is a track in the MA in mental health counseling, and actually just recently in the MSED in counseling as well, which offers that while taking your MA in mental health or MSED, at the same time, by taking some some of your electives in the substance abuse area, you can also receive additional requirements for your KSAC credential. The KSAC credential is a certificate in alcohol and substance abuse counseling under the New York State Office of Alcohol and Substance Abuse Services, or OASAS. The slide here clearly defines for you what is a substance abuse counselor, and it does work with people who have any kind of addiction. So it's a broad possibility, and it's an additional certification that you could get while you're also working towards your mental health counseling or your MSED in counseling. The work settings for substance abuse counselors, obviously mental health and substance abuse centers are a big area, prisons, probation or parole agencies, juvenile detention facilities, halfway houses, detox centers, and again, once again, it is eligible for private practice for the mental health counseling. School counselor, I mentioned the MSED. We have two tracks under the MSED, and that would be the school counselor and the college student development counselor. And a school counselor is what traditionally would be called a guidance counselor, and so they work with children and adolescents in K through 12 settings in elementary, middle, high school, in both public and private institutions. And they work with students to develop the social skills so that they're able to succeed in school, and also work with obviously parents and teachers and administrators, and also help in that transition to after school, meaning transitioning them either to college or to the world of work. Of course, talking about college brings us to the college student development track, and this is also part of the MSED in counseling. And these would be people who would be very interested in working on a college campus. And most often in those areas that are more related to the counseling aspects that we would consider university advisement, career, admissions, or student affairs. And they work with students who are transitioning to college, into college, and then transitioning out of college again into the world of work. And many times it deals with academic advisement and personal advisement. So for the MSED in counseling, this is a 42-credit master's. It does take 2 years, and there's a capstone supervised internship, which is 200 hours, and that 200 hours would be either in, if it's a school counseling program, high school, middle school, or elementary school, or if it's a college, it would be in a college student development area on a college campus. Moving on now to creative arts therapy. We actually have an MA in creative arts therapy, and the unique thing about creative arts therapy, again, it is a mental health profession, but it really uses the art medias and the creative processes to facilitate the counseling process. It does help people to really explore their feelings, and many times it works very well with people who either can't speak about what's going on or aren't able to articulate their feelings or don't want to articulate their feelings. They are able to get that out through their arts. And so we use the visual arts, clay, sculpture, drawing, and there's a lot of electives in our expressive arts as well. Creative arts therapist works with individuals, and they also work with groups. And again, across the lifespan and all ages. They do work in hospitals, rehabilitation facilities, wellness centers, crisis centers, senior communities, forensic institutions, and they also have the opportunity for private practice. Our MA in Creative Arts Therapy is, again, a licensure eligible program. It is currently 53 credits, and there's also a 600-hour supervised internship. Our program is approved by ADA, which is the American Art Therapy Association. And upon graduation, our students do get a limited permit for creative arts therapy, and they also are on their way to gaining their licensure as well as their art therapy license as well. The Marriage and Family Therapy Program is quite popular here at Hofstra as well. They work with couples and families, obviously, to explore and improve conflict resolution and relationships amongst the family. They also work across the lifespan, so they can work with children in the family all the way up through senior adults. They help families deal with all sorts of issues, developmental issues and relationship issues. They focus in on parenting strategies, loss and grief in the family, and the overall idea is to improve family functioning. They work from a systemic approach, and so they look at the whole system and how that impacts the individuals in that system. Their work settings are in community and mental health agencies, hospitals, child welfare agencies, juvenile justice programs, and once again, private practice. The educational component for MFT is that it's a 54-credit program. It's a supervised internship of at least 300 client contact hours, and the hours spent by students are in their internship actually goes towards their 1,500 client contact hours required for licensure after graduation. Finally, I want to talk about the Rehabilitation Counseling Program. It's the 4th track in our area. There's actually 2 programs. There's the MSED in Rehabilitation Counseling and the MSED in Rehabilitation Counseling and Mental Health. It's a dual program. First, though, what is a rehabilitation counselor? So a rehabilitation counselor is somebody who wants to work specifically with people who are living with a disability in their lives and help them to actually become more independent. So they work with clients to overcome personal, social, or professional effects of a disability, and again, to focus in on independent living. They work in comprehensive rehabilitation centers, mental health clinics, rehabilitation hospitals, drug and alcohol agencies, correctional facilities, independent living centers. They do work for insurance companies and many times in Veterans Affairs. So the MS in Rehabilitation Counseling is 51 credits, and it does prepare students for a national certification, CRC, which is a Certified Rehabilitation Counselor. And then the other option is the MSED in Rehabilitation Counseling and Mental Health Counseling. It's a dual program with 60 credits, and this prepares students for both. They would be prepared to take the CRC exam, Certified Rehabilitation Counseling, as well as be licensure eligible for mental health. Our program is accredited by CORE, which is the Council on Rehabilitation Education. So that's a little bit about all of our different programs. You might be thinking, well, gee, what's my future possibilities if I decide that I'm very interested in one of these specialty areas? What might be where I would work in the future? What are the career opportunities? And I'm pleased to tell you that based upon all the different areas that we look at, U.S. News and World Report has ranked our program, these professions in the top 100 jobs for 2014. The U.S. Bureau of Labor Statistics reports that the employment, obviously mental health, marriage and family, substance use counselors is expected to grow much faster than the average. And ONET lists all of the professions as having a bright outlook. And so we do think that there are many opportunities for jobs as we move into the future. So many people want to know what happens when I come to Hofstra, what's my experience like, and we are really proud of the fact that we provide great programs in the classroom. I think anyone who attends our programs, and if you speak to any of our alums, will tell you that they've had a wonderful experience in the classroom, but it's more than that. They've also had co-curricular experiences outside of the classroom, as well as professional opportunities as well. So our student involvement is we have 5 different clubs and organizations, and not only do they work independently, but they also work on things together. So they start to understand that interprofessional experience even as a student. The first is Chi Sigma Iota, which is the International Counseling Honor Society. We have the Lambda Nu chapter here on our campus, and so students who have taken 12 credits and have a 3.5 GPA are eligible to apply to Chi Sigma Iota. We also have the Creative Arts Therapy Club, or CATCH, the Counseling Club, the Marriage and Family Therapy Club, and the Rehabilitation Counseling Student Association. And as you can imagine, they focus in specifically on their areas, but also invite the other clubs and organizations to attend. And what they usually do is bring in speakers and related events and activities, as well as do advocacy projects into the field. You may be wondering about admission to Hofstra, and at this point you can, of course, go to hofstra.edu/gradapply, What do we want from you? The information that we request is your transcripts, your current GPA. All the programs request a personal statement or essay, and we ask that you then identify what it is about your background and your experiences that make you want to be working in the field of creative arts therapy or marriage and family therapy or counseling. You would require 3 letters of recommendation, a personal interview with the program director or a faculty member in the specific program. If you are an international student, we do require a TOEFL. Other things that you might want to keep in mind, the GRE, and I know some people cringe when they hear that, but you shouldn't. You should take the GRE. It's not bad. It is required for the MS-ED in Counseling program and the MFT, the Marriage and Family Therapy program. It's not required for the other programs. Portfolio, an art portfolio, is required if you're interested in the Creative Arts Therapy program, and a resume is required for the rehab program. We do have a rolling admission, although we do encourage you to submit your application as quickly as possible so that it has the most chance of being reviewed, and it gives an opportunity not only, again, to review, but to schedule an interview and to allow you to come in and get to know the faculty a little bit as well. There are some scholarships available, but we always encourage everyone to apply for need-based financial aid through FAFSA. The other thing that we strongly encourage you to do is to look at the Hofstra webpage regularly to see what graduate assistantships are offered, because sometimes they offer some additional assistance regarding tuition benefits as well. And you can do that right on the job section of the Hofstra webpage. I'd also like to invite you to our open house. Our next graduate open house is going to be on Sunday, November 23rd. And if you decide to attend, we will have representatives there from all of our programs. Mostly it's the program directors, and oftentimes there's some students or alums that are there that you're able to talk to. If you're still not sure which program would be best for you, you could speak to each of the different program directors all in one time. And if you decide to come, you can RSVP at hofstra.edu/grad-events. And that way we'll know that you're coming. And if something comes up, of course, we would just be able to follow up with you afterwards as well. I encourage you to contact our program director, specifically if you have any very specific questions at this point. And the contact for each of our program directors is listed here. And they would be more than happy to get back to you to either set up an appointment or to have you discuss something with themselves or, again, with a current student, depending on what your question actually is. And if you have any questions or need assistance regarding the application, you could speak with our Assistant Dean of Recruitment and External Affairs, Nicole. Thank you again for coming. Now I'm going to open it up to any questions that you might have. All right, great. Well, the first question that I have is from one of our attendees who asks what time our classes actually offered, and that's a great question. Thank you so much for asking that. Because, of course, we are a graduate program, we recognize that most of our students, even though they might be attending full-time in graduate school, so most of our classes, with recognizing that most of our students work during the day, start at either 4:30 or 6:30 in the evening. And they go, usually the latest would be till about 8:20 or 8:30. So our classes do try and take into consideration, again, that people are many times coming back to school and are coming back and working as they're going to school. Oh, second question, thank you. Do students receive help with internship placement? Again, great question. Yes, students do receive extensive help with internship placement because internships have to be in the mental health areas, we need to make sure that our internships meet all the standards for the state, and therefore there needs to be a contract between each internship site and Hofstra University. So the way it works usually is that through academic advisement, when you're meeting with your advisor, you'll be discussing what your interests are at the time, and we recognize that your interests might change. But if you're interested perhaps in working with adolescents, then we would look to see which sites we have available that meet your interests. And so we try and do a match. And again, we're able to do that because one of the things that you'll notice about our program is that they are intentionally kept to a modest size, meaning that we try and work directly with you so that you will have direct contact with your faculty throughout the time, but particularly with your academic advisor, who will really be working with you throughout your entire 2 to 3 years when you're with us. And so when it comes time for internship, we really kind of will work with you so that you have a good internship site. Okay, question, do you accept credits from community colleges if you need to take a prereq course before matriculation? Okay, yes, we actually do. You will notice if you've been on our website that we do have prerequisites. Usually for most of the programs, there are psychology prerequisites. So let's say that you're doing a career change and you didn't have adolescent psychology, or child psychology, but that is a prereq. Yes, we do accept prerequisites from a community college or any other college that you've taken that course in. If you haven't taken it and you'd like to take it, we also encourage you to look at, you can take the courses DL, and I know that SUNY offers, if you type in SUNY/distance learning, you'll be able to find what they offer in programs as well. Those prerequisites are required for us for multiple reasons. One, it's part of our state, what we've been approved by the state, so we have to have those prerequisites on the books, on your record when you're here. And the second thing is, we want all of our students to come in with a general knowledge base. And so we don't actually go back to that. So we don't go back to child psychology knowing that you all have that. So we move forward from there. And it helps us to know that everyone's starting at the same page. Oh, good question. The second, what is the usual class size? I mentioned just briefly that we do keep our class cohort intentionally small. So that's not to say that we wouldn't double up on cohorts if necessary, but we do try and keep them to about 20, no more than 20. And so you'll find that most of your classes are no more than 20. And again, by the time you get to practicum and internship, you're going to find that those classes where we're doing the direct supervision are going to be closer to 6 or 8. Question: Once you've begun, do you allow students to take a course at another school and have the credits transferred? That also is a very good question, but unfortunately the answer to that one is no. Once you begin our program, we actually prefer, unless there was some tremendously extenuating circumstances, that you maintain in the program and continue to take the courses in our program. There are some transfer credits allowed sometimes before. So for example, if you have taken a course or two at another college, four-year college accredited school, as in the master's program that you like to request to transfer, you can do that through the program director. It's usually no more than 6 to 9 credits, and it's not always all of those credits, but you would need to have the syllabus from that course, and you would need to petition for those credits. And again, it's usually not the actual counseling credential type courses. They're usually much more some of the, perhaps you took a research course, or perhaps you took something in the content area, but it's not usually the direct counseling areas. Okay, here's another question. If I want to be a psychotherapy specifically for depression, anxiety, and substance abuse in a private practice setting, what degree should I get? Okay, so if you're interested in psychotherapy specifically for depression and anxiety and substance abuse, it would sound to me like that area, since it's pretty broad, would probably be focused more in the mental health counseling program. And the reason why I say that is the mental health counseling program is the broadest of the areas in the scope of practice and the professional orientation, and it also includes the possibility for the CASE Act, the substance abuse program. Okay, another question. I'm interested in applying for the spring semester. Does Hofstra accept applicants for the spring? Well, yes, and welcome. We'd love to have you in the spring. I understand that it is getting later, except keep in mind that for us, spring semester starts in February, or at the end of January, the last week of January, I believe. So you not only have the next few weeks to get your paperwork in, you also have some time in January. Once again, we are in a rolling admission, although we would prefer to do it earlier rather than later to make sure that you're set with your registration and able to move forward in those areas. So we encourage you to send in things as quickly as possible, but there still is time for the spring. Let's see. So, one question, do you do dual degrees other than the rehab counseling program? We have a dual degree in rehab counseling and in mental health, and the only other one that would be similar would be the substance abuse with the mental health. Although those aren't two separate degrees, it's a separate certification as well. Are mental health counseling students allowed to take more than 60 credits if grades are high enough? More electives. Oh. Well, sure. The question is, are mental health counseling students allowed to take more than 60 credits? Yes, of course, you could always take additional electives, and that's always the hardest part, isn't it? That, you're in a program and you're not exactly sure. So much of the program is very much set in what you need to take for licensure. But then there's some really great, wonderful electives that you'd like to take. Maybe you'd like to take something in aging, or you'd like to take something in substance abuse, but you're also interested in rehabilitation, so you want to take some in there, or a creative arts therapy class. We understand that. You're required to take the 60 credits, but certainly if you wanted to take additional classes, that would be fine. Okay, well, thank you very much, and thank you for all of your questions. If you have any additional questions, please feel free to either contact any of the contact information here of the program directors or for Nicole. We'd be happy to continue the conversation, and please be in touch. We look forward, I hope I answered some of your questions, and we look forward to welcoming you to campus in the future.